Hi, I'm Lisa Squires, Senior Communications Advisor with Alberta Health Services, and this is Health Matters. Today we're going to be talking with Pat MacIntosh, and Pat is a registered dietitian with Public Health Services here in Medicine Hat. And today we're going to be talking about vitamin D. So thanks for being here, Pat.
Hello.
So vitamin D is actually one of the ones I hear a little bit more about in the media and stuff, but maybe you could just let us know what exactly is vitamin D and why is it important?
Vitamin D is a fat-soluble vitamin that has a lot of body functions, but the primary one is for bone health. And so one of the reasons we've got our recommended daily intakes is really to keep our bones strong. So for children who are still growing and developing, if they don't get enough vitamin D, they could end up with soft bones or rickets. And older adults, if they don't get enough vitamin D, they could end up with osteoporosis or brittle bones. So it's really to keep our bones healthy.
And do we actually get enough vitamin D in the foods that we eat?
No, there's very few foods that actually have vitamin D naturally. It is added to some foods like liquid milk and infant formulas, but it's still not very much. So about a cup of formula or milk will give you about 100 international units of vitamin D. But infants from a year older to age 70 need 600 international units a day. So to help meet our daily requirements, Nutrition Services has come out with updated guidelines for vitamin D supplements. And so that is all infants, whether they're breastfed or formula fed, all children, all adults, including pregnant and breastfeeding women, should have 400 international units of vitamin D a day. Adults 70 years and older should actually have 800 to 1,000 vitamin D, international units of vitamin D a day. And so for children and adults, that could come either as a single supplement or as part of a multivitamin, but for infants, it really should come as a single vitamin D supplement with no other vitamins or minerals added. And there are other options like D drops where it's just a single drop. And then there's some like the droppers where a whole dropper full would give you 400 international units. And so that's really a daily requirement now.
And so you mentioned these supplements. Like I know we can also get vitamin D from the sun. So do we actually even need the supplements?
We do, because we can make vitamin D in our skin, but in Canada we're so far north, we can only really do that in the summer, basically April through September. But part of what we also do is sun safety guidelines, and so that generally means stay out of the sun during the middle of the day, use sunscreens, and a sunscreen of SPF of 7 will block vitamin D production. So really, because of sun safety practices, we can't make vitamin D naturally, so it means we need that supplement every day.
Well, thanks, Pat. That's some really good information. I've actually learned that I'm not getting enough vitamin D, and I probably should look into fixing that. I hope all of you are getting enough vitamin D. I'm Lisa Squires, and this is Health Matters.